Hi everyone. So here is a quick way to learn about the heart circulation in just very easy steps. So you can imagine the heart being as a shape of a box. In the shape, there is four quadrants. So four sides of the heart as left atrium, right ventricle, left ventricle. Between the right atrium and the right ventricle, the valve that's there is called a tricuspid valve. So tri refers to three. Cusps are just the shape of the cusps. So there's three cusp shaped valves that are separating right atrium and right ventricle. Similarly, between left atrium and left ventricle, we have the bicuspid or mitral valve. When you think about the right ventricle, the blood is going from right atrium to right ventricle, and between right ventricle, the valve that's allowing the passage of the blood flow is called the pulmonic semilunar valve. So pulmonic refers to lungs, and semilunar, if you split the words apart, semi is just half, lunar is moon shape, so that's the semilunar valve. It's going to the lungs. And then similarly, between left ventricle and the aorta, we have the aortic semilunar valve because it's going to the aorta. So let's think of the circulation. So the deoxygenated blood comes to right atrium by coronary sinuses, superior vena cava and inferior vena cava. When you think of coronary sinuses, these are just the large veins on the backside of the heart that return blood from capillary beds of myocardium. So myocardium is a muscle tissue of the heart. So the sinuses are bringing that deoxygenated blood to the right atrium. Superior vena cava brings blood from the upper portion of the body, so your head and neck, and inferior vena cava brings the deoxygenated blood from the lower part of the body. So it's important to know that all the deoxygenated blood that's rich in carbon dioxide and low in oxygen comes to right atrium. So once the blood is coming to the right atrium, slowly the pressure in the right atrium increases with all the blood coming in. The increase in the pressure leads to the opening of the tricuspid valves. And once that valve is opened, it allows one side flow of blood from right atrium to right ventricle. So about 70% of the blood is just flowing um, into the right ventricle. So when the right ventricle is about 70% full, um, the right atrium goes into something called atrial kick, where the atria contracts and push the remaining 30% of the blood. Once the blood reaches the right ventricle and the pressure in the right ventricle increases, the pulmonic semilunar valve opens and it takes the deoxygenated blood to the lungs with the help of pulmonary arteries. So now if you go back to arteries and veins, you know that arteries always carry oxygenated blood and veins carry deoxygenated blood. There is one exception in case of the heart where the arteries that carry deoxygenated blood or pulmonary arteries are the only ones that carry deoxygenated blood. Similarly, pulmonary veins carry oxygenated blood. So once the blood reaches the lungs, there is an exchange of oxygen and carbon dioxide. So the blood is now filled with loss of oxygen. So the oxygenated blood comes to left atrium with pulmonary veins. So when um, the blood comes to left atrium and the pressure of the left atrium increases or exceeds the pressure of the left ventricle, there is opening of mitral valve. Slowly, when the left ventricle fills in and the pressure in the left ventricle increases, it closes the mitral valve right here and it opens the aortic semilunar valve and the blood is pushed to aorta. So, aorta is the largest artery in the body. It supplies blood to all the oxygenated blood to all the body tissues. If you think of aorta kind of branches off to smaller arteries called arterioles, and similarly veins get divided into smaller vessels called venules and then finally into capillaries, and from there the blood gets distributed into the body two coronary arteries because as much as our body needs fresh oxygen, the heart arteries also need that oxygenated blood. So it goes to the coronary arteries, brain, your gut, your renal system, and muscles. So this is how the blood gets oxygenated, and once the distribution is happening, there is an exchange of oxygen and carbon dioxide. The body is again bringing that deoxygenated blood through inferior superior vena cava and coronary sinuses right back into right atrium. So the cycle kind of continues where the deoxygenated blood is coming through here, going to the right atrium, going through tricuspid valve to the right ventricle, and it's going to the lungs to get oxygenated. Coming back, the oxygenated blood comes to left atrium to left ventricle with the help of these valves. So it's important to know that both sides of the heart function as two pumps kind of working simultaneously. So this is happening very, very quickly. And the other two terms that I really like to emphasize are the pulmonary circulation or systemic circulation. So when we think of pulmonary circulation, think of the heart bringing that blood to the lungs and lungs kind of purifying that blood and bringing it back to the heart. Whereas when you think of systemic circulation, the heart is giving that oxygenated blood to the body and the body is giving that deoxygenated blood to the heart. So this kind of circulation refers to as systemic circulation. I hope you enjoy the video. If you want me to make any topics much simpler in a concept map way, please feel free to write that in the comments.